Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board-certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast.
We will jump right in and get started with the first questions here. Talking to clients about dental x-rays and how do we, get them to move forward with that as part of the total dental procedure. And I can't stress enough that dental x-rays are absolutely required for any type of high quality dentistry. Unfortunately, just cleaning teeth, and I'll talk about that a little bit more here, just cleaning teeth really doesn't have the benefit. And whenever I talk to folks, I have 100% compliance because it is a non-negotiable component to our total procedure that we're going to do. And so we have to get away from thinking about this as just cleaning teeth and think of this in a whole different type of mind shift, and then explain that as best we can to our clients. So here are some key statements that I really want you to become familiar with, have this available so that when talking to clients, it's a no-brainer, absolutely no-brainer. There's no question why we would do x-rays for a number of different reasons. Unfortunately, just cleaning teeth, if there is disease already present, has little to no benefit. The disease will progress to the point where we've passed the point of treatment and pathology is missed. And so then we get to the point where our only option is extraction. And we absolutely want to find stuff before that. Patients under 15 pounds, 85% of those patients, that's a really high statistic, have some degree of periodontal disease. The earlier we find it, the better. No question. There are therapies that we can do to help stop the progression or slow the progression and ultimately prevent tooth loss and extractions. That's what dentistry is being as proactive as possible to find pathology early. And unfortunately, our patients will never ever tell us anything. We have to rely on dental x-ray to be able to find all of that pathology early enough where we can still treat it. So we want to make sure that we're keeping all of this in mind when we talk to clients and when we're making estimates. This is absolutely part of that total dental procedure, just like pre-anesthetic blood work or IV fluids. Those things are non-negotiable. We would never anesthetize a patient without doing a full blood panel or a full workup. We would never anesthetize a patient without IV fluids. And we would never anesthetize a dental patient without taking dental x-rays, because our goal is to find pathology, find it early so that we can treat it and prevent tooth loss. The other component that we need to keep in mind when talking to our client base regarding dentistry is not for everyone. This is primarily an A and B client service. And I know that's kind of harsh, but it's a reality. Not all of our clients are compliant. And unfortunately, without being compliant, a lot of the things that we recommend are not adhered to. And dentistry is one of those. But we have to keep in mind that this 80-20 rule comes into play. 20% of your client base makes up 80% of your revenue. And that 20% are your A and B clients. Those are the ones that are going to take advantage of your recommendations. They are going to make sure that they're following what you're recommending to keep their pet healthy. And they're expecting good quality veterinary medicine, and they are willing to pay for it. And dentistry is one of those high-end services that in order to do it appropriately, we need to be able to offer this with absolutely dental x-rays, and then good oral surgery, periodontal therapy, all of those things that go into treating these patients appropriately. And so we would never, ever proceed without assessing these patients appropriately, and then move forward from there. And that's what most of your patients want. Most of them are wanting to be able to prevent tooth loss if we can, and dental x-rays is the only way that we can do that. Just cleaning the teeth isn't going to cut it. So I hope that kind of clears that up, and I hope that gives you some statements to have in your arsenal to be able to educate your clientele or re-educate your clientele appropriately with regards to dentistry. It's not about cleaning the teeth, although we're going to do that. That's more or less incidental and preventative, but our goal is to assess, treat, and then prevent from there. All right, we talked about creating a dental team, and question here from Katie and Deborah regarding a dental team, and a number of reasons why we like to keep that dental team small, and we like to be able to have as much consistent staff in the dental department or doing those dental procedures, only because dentistry is one of those services that requires a pretty fair amount of knowledge and skill. And unless you're doing it on a pretty regular basis, it takes a long time to get over that learning curve. And we want all of that knowledge to be very well-based and well affirmed in the staff's kind of knowledge base, so that when they talk to clients, they can speak to clients confidently, and that they're more efficient once we're in that dental suite and actually performing those dental procedures. And so trying to rotate everybody through that dental suite can sometimes be really challenging. And with our dental service, there's Dr. Beckman, myself, and Jennifer, my anesthesia technician. And because we're doing it, over and over and over, and we're doing it consistently, we have a pretty efficient, we don't even have to think about it. It's just second nature how we complete these cases, what we're doing. And so that really increases the efficiency as well as the confidence level when you're dealing with your patients. So we typically recommend 1 to 2 docs and 1 to 2 or 3 technicians. And this is some of the goals here and advantages. Those folks that are motivated, not everyone in the hospital wants to do dentistry. And so we would never force anyone to do that, because they're just not going to, number one, take advantage of CE, and number two, most likely they won't implement. And implementing new techniques is absolutely critical whenever we're taking advantage of any CE, dentistry or otherwise. And those folks that don't have a passion for dentistry are very highly unlikely to follow through. And so what we're trying to do is create what's called a cross-functional team, where each team member has a very specific skill set, and all working toward that same common goal, which is treating dentistry patients appropriately and thoroughly, and trying to keep that anesthesia time as short as possible, and have a successful outcome. So all of those things go into having a really nice, small, concise team. And a lot of hospitals will actually have that dedicated team where they have specific days that they do nothing but dentistry, maybe 2 or 3 days a week. And then the other days a week, maybe soft tissue surgery, maybe 1 or 2 procedures, but that they devote, a full day or 2 to dentistry. And those practices that kind of embrace that philosophy can significantly increase their revenue, because dentistry is one of those really high revenue services when it's done correctly. We've got some questions regarding pre-medication from Jessica and Shawa. Our pre-med that we use for our kitty cats is primarily the buprenorphine and midazolam. And our patients are admitted in the morning and pre-medded, and then we're usually done, within a 6 to 8 hour period. And our pre-med lasts pretty much that entire time. And then we're also doing other pain medication. We're doing nerve blocks. So they're going home with pain medications on board as well. The pre-medication, we either do IV or subq. Is there a reason we don't give that IM? Absolutely. And it's a very simple reason. It hurts. And we want to make sure that we are making this visit as benign as possible. These patients tend to remember. In our practice, we try and be as fear-free as possible. And so anything that is going to cause discomfort, is going to cause any kind of anxiety or pain, we try and minimize as much as possible. So that's really the only reason that we don't give it that route, because we want these patients to come back. And they have to come back in some cases pretty often. So we want to make sure that it's as pleasant as possible for not only the patient, but the pet parent as well. Good question. All right, so question about Premeds again, using Hydro and Domitor for canines and Kitty Magic for cats. Any suggestions on recommending a change in protocol? And these agents are absolutely wonderful agents. They're not necessarily bad to use, but they're just not appropriate for the dental patient specifically. Number one, they just provide too much sedation. We don't need them that out of it. We want to provide agents that are going to be metabolized quickly, and that these patients are very awake when they go home, and we're able to keep them very light under anesthesia. And Dexdomitor especially provides really good pain management, but it's just too much sedation. And we have to keep in mind that these clients are already very, very nervous about anesthesia. And if their pet goes home very, very sedate, very sleepy, very just not like when they came in, and our patients are ready to go usually within about an hour after we're done, and they're very, very awake. The problem is if they're just too sedate, they will most likely not return. It's just too much anxiety for the owner. They're expecting their pet to die under anesthesia, as we've had, mortality rate. Everyone's heard of someone or had a patient die under anesthesia, unfortunately. It's usually with regards to dentistry. And so we have to be really, really careful on how these patients go home. Now, certainly you can reverse the Domitor so that they're awake, but the problem is when you do that, it also reverses the pain component associated with that agent. So reversing it, your patient could wake up painful, and we don't want that either. They need to go home and be very, very comfortable. So we use very benign protocols. Patients that are at high risk, for instance, any cardiac patients, Dexdomitor is absolutely contraindicated. So we use protocols that can be used on pretty much everyone, but not only because we like to be as safe as possible, but we want to make sure that those patients are going home nice and awake. And dexdomitor just provides way too much sedation.
I trust you enjoyed that episode. We enjoyed providing it. If you would, do us a big favor and go to our iTunes page, post a rating and review, and take a picture of that with your cell phone, and then post it on our Facebook page, and we'll send you the Instrument Use Essentials course. If you also look below, there is a link to 2 live trainings that we do. And one is on radiographic interpretation. The other is on killer tips for quicker extractions. If you have not been to those, register for the one that's coming up next. And the link will be in the show notes on the website, the Vet Dental Show. And we'll get you in and get you a 30-minute, 40-minute overview of those topics that are really insightful and all take home. And then we'll also give you an opportunity to get a great deal and some bonuses on those 2 courses that are online courses that span 5 hours and 7 hours. So hopefully you enjoyed this episode. Hopefully you'll help us out with the post on our Facebook group. And then as a little extra bonus for you, you've got that link down there. You can register if you haven't been to either one of those and enjoy all of that content that we're going to give you on those 2 topics. So take care. We'll see you next week.